Meet Dr. Miller, a seasoned cardiologist with a knack for explaining complex medical terms in a simple way. He's got years of experience under his belt and a passion for educating not just his patients, but also the next generation of doctors. Today, he's meeting with Abigail, a patient who's recently started showing symptoms of a heart condition. Abigail, like many of us, is not fluent in medical jargon, but she's eager to understand what's going on with her health. Across the room, we have Jack, a bright-eyed medical student. He's always ready to learn, and today he's got a front-row seat to a real-life medical consultation. Jack's here not just to observe, but also to understand, as Dr. Miller breaks down complex procedures like transoesophageal echocardiography and stress echocardiography into bite-sized information. With Jack, the eager medical student, listening in, the stage is set for an enlightening conversation. Scene script. Dr. Miller starts by explaining the concept of transoesophageal echocardiography to Abigail. Imagine the human heart as a majestic castle, Abigail, Dr. Miller begins. There are many rooms, chambers, and corridors, some of which are only accessible with the right key. Transoesophageal echocardiography, or T, is one such key. Dr. Miller's voice takes on a tone of intrigue as he explains how this invasive procedure involves the insertion of an ultrasound probe into the esophagus. This provides us with a better resolution of the heart and its structures, he says. It's like having a camera inside the castle, giving us a detailed look at the rooms and corridors. He further elaborates on how T helps in the visualization of posterior structures such as the left atrium, mitral and aortic valves, and the interatrial septum. These are areas that are challenging to view clearly through traditional methods, he states, but T gives us the ability to see them in all their detail. Dr. Miller doesn't shy away from highlighting the crucial role of T in detecting a range of conditions: intracardiac thrombi, tumors, valvular vegetation such as those in infective endocarditis, aortic dissection, aortic atheromas, prosthetic valve function, shunts, and even technically inadequate transthoracic studies can be identified and assessed with T, he announces, the importance of his words hanging in the air. As he wraps up his explanation, Dr. Miller mentions the use of Doppler with T to quantify the degree of valvular stenosis or regurgitation. This combination, he explains, allows us to measure the severity of the condition and plan a course of action accordingly. As Dr. Miller explains, T is a powerful tool in the cardiologist's arsenal, helping them see what the naked eye cannot. His words echo in the room, a testament to the wonders of medical science and its ability to unlock the secrets of the human heart. Next, Dr. Miller turns to the topic of stress echocardiography. As he begins, he explains that it's not as stressful as it may sound. Quite the opposite, in fact. Stress echocardiography is a technique that pairs echocardiography with either physiological stress, like exercise on a treadmill or a bike, or pharmacological stress, such as a dobutamine infusion. He continues, think of it like a stress test for the heart, but with a visual component. The echocardiogram allows us to see how the heart muscles and valves perform under stress. This makes it an invaluable tool in detecting myocardial ischemia, a condition where the heart muscle doesn't get enough blood due to narrowed or blocked arteries. Dr. Miller then points out that stress echocardiography isn't just about detecting problems, it's also about assessing viability. Viability, he explains, refers to the potential for recovery of heart muscle function. If a portion of the heart muscle is not contracting well because of poor blood flow, stress echocardiography can help us determine if this condition is reversible. Moreover, Dr. Miller adds, stress echocardiography provides us with crucial information about the global left ventricular response to exercise. The left ventricle, as you may know, is the heart's main pumping chamber. By observing how this chamber responds to stress, we can get a comprehensive picture of its overall function. As he concludes, Dr. Miller emphasizes the central role of stress echocardiography in evaluating valvular heart disease. The heart valves, he says, are like doors that regulate blood flow in the heart. When they don't open or close properly, it can lead to valvular heart disease. Stress echocardiography allows us to observe these valves under stress and assess their function. Stress echocardiography, Dr. Miller points out, is essential for evaluating valvular heart disease. And with that, we're ready to dive into our next topic. Delving deeper into the world of cardiac imaging, Dr. Miller introduces the concept of contrast echocardiography. This advanced technique, he explains, involves the use of contrast agents that are injected into the bloodstream to enhance the imaging of the heart. One such agent is agitated saline. an intriguing compound that contains microbubbles of air. When this saline solution is introduced into the bloodstream, it gives us a much clearer view of the right heart and intracardiac shunts. These are pathways that allow blood to move from one part of the heart to another, bypassing the normal route. The most commonly visualized shunts include the patent foramen ovale and sometimes intrapulmonary shunts. But the world of contrast echocardiography doesn't stop there. Dr. Miller continues to explain the advent of newer contrast agents. These innovative agents have the unique capability of crossing the pulmonary bed and achieving left heart opacification following an intravenous injection. What does this mean? Well, in layman's terms, these agents can enhance the visibility of endocardial borders, the inner lining of the heart chambers. They can also improve the evaluation of the left ventricular ejection fraction, a measure of how well your heart is pumping out blood. But the benefits don't stop there. These new contrast agents can also help in assessing wall motion abnormalities, which are irregularities in the movement of the heart's muscular wall. They can even help identify an intracardiac mass, which may represent a tumor or a clot. As Dr. Miller wraps up his explanation, he emphasizes the transformative impact of contrast echocardiography on cardiac imaging. This technique has allowed cardiologists to see the heart in a whole new light, enhancing their ability to diagnose and treat heart conditions with greater precision. With contrast echocardiography, we can see the heart in a whole new light, Dr. Miller concludes. The world of cardiac imaging, it seems, is full of exciting possibilities. As the conversation draws to a close, Dr. Miller emphasizes the importance of individual consultations. Our journey through these complex medical procedures may have provided a rudimentary understanding of echocardiography and its various forms. The conversation between Dr. Miller, Jack, and Abigail, however, has underscored one crucial point. Each patient's case is distinct, unique as a fingerprint. Dr. Miller, in his calm and reassuring voice, stresses, "These explanations, while comprehensive, are merely a general guide. Each patient presents a unique case, a different story written in the language of the body. For instance, Abigail's symptoms and medical history may lead us down a different diagnostic path than another patient with similar symptoms." The importance of individual consultations cannot be overstated. They allow for a more personalized, in-depth understanding of a patient's condition. A one-size-fits-all approach, while convenient, is far from effective in the realm of healthcare. Our bodies are complex systems, each one reacting differently to the same stimuli. Dr. Miller continues, "A professional provider, whether a cardiologist like myself or another specialist, can provide a comprehensive diagnosis and treatment plan tailored to your specific needs. We take into account not only your symptoms but also your medical history, lifestyle, and individual health goals. This personalized approach ensures the most effective treatment plan, minimizing potential risks and maximizing benefits. It also fosters a deeper connection between the patient and the healthcare provider, leading to better health outcomes." As Jack, the medical student, absorbs this wisdom, he recognizes the importance of treating each patient as an individual, not just another case study. He understands that his future practice must be rooted in empathy, respect, and an unwavering commitment to individualized care. Remember, each person is different and so is their heart. Always consult a professional, Dr. Miller cautions before ending the conversation. Wise words indeed, reminding us all of the importance of personalized, professional healthcare in the journey towards a healthier heart.